Good afternoon, everybody. We're going to get started here. I am joined today for today's press conference by Dr. Rosa, our Health Commissioner, Catalina Rodriguez Lima, our Director of Mayor's Office of Immigrant Affairs, also known as Lima, Lydia Walter Rodriguez from Casa, Baltimore. Lydia. And we are also joined by Matthew Dollamar, the Director of Catholic Charities Esperanza Center, and Reverend Rosa Margarita Santana. We are also joined by Cynthia Sanchez. Today we also have Tisha Edwards, the Director of the Mayor's Office of Children and Family Success, Holly Frestadt, Food Policy Director for the City of Baltimore, and Deputy Commissioner Michael Sullivan from the Baltimore Police Department. As of Thursday, December 17th, Baltimore City has had 28,848 reported cases of COVID-19, 391 people hospitalized with COVID-19 between ICU and acute care. Our hospitals are at 86% ICU capacity, 87% acute care capacity at this time, and we are at, unfortunately, 586 deaths. We've said this many times, I'll say it again, this virus is very serious. Our parents, our grandparents, neighbors, and friends are dying from COVID-19. We have to do everything we can to slow the spread and keep our community safe, particularly with the upcoming holidays. I want to thank everyone who has been doing the right thing to control the spread of this virus. Wearing your mask in public, when meeting with friends and family, virtually rather than in person as we go through the holidays, and in your home, maintaining physical distancing, and staying home when you feel sick. Everything down to simply washing your hands helps to slow the spread of this deadly virus. I would like to invite up now Commissioner Rosa to say a few words about COVID in Baltimore.
Good afternoon. Thank you, Mayor Scott, for your leadership during these difficult times. This afternoon, Director Catalina Rodriguez from the Mayor's Office of Immigrant Affairs will be announcing the culmination of months of planning, stakeholder outreach, and community listening sessions as the city works to directly confront the disproportionate impact of the COVID-19 virus on the Latinx community. Early in the pandemic, Baltimore City's COVID-19 case data pointed to evidence that COVID infections were disproportionately affecting the Latinx community. We learned that our Latinx population was 2.5 times more likely to be diagnosed with COVID-19 when compared to non-Latinx residents here in the city. With consultations with Lima, the health department set out to ensure more equitable access to information and testing for this community. We work with their office to translate relevant materials in multiple languages, ensuring widespread understanding among all our residents, and we also hosted Latinx focus groups to ensure that our Spanish COVID-19 messaging was effective. We work to create partnerships with community centers and churches to provide free testing in predominantly Latinx neighborhoods. And in August, Lima and the Health Department reached out to governmental agencies and representatives from nonprofit organizations, religious leaders, and community groups to coordinate at the Baltimore City's COVID-19 Latinx response. We knew that continued multifaceted, targeted interventions would be necessary and focused our meetings on prevention, testing, and supporting our Latinx residents. I would like to briefly mention some initiatives during this work group that were implemented to help limit the spread of COVID-19 in the Latinx community. The Health Department continues through collaborative efforts with our partners to ensure that community testing in the Latinx population is very accessible. The Health Department is also partnering to make available linguistically and culturally competent contact tracers as a part of our Baltimore Health Corps program. Bilingual contact tracers refer residents to resource navigators to increase our ability to engage with people who have tested positive or who are contacts of known cases, and can offer existing resources to ensure effective quarantine or isolation. Effective contact tracing has been and will continue to be one of our strongest methods to reduce the spread of infection. Finally, the Health Department continues to promote the city's Triage, Respite, and Isolation Center to ensure our Latinx residents, regardless of immigrant status, can safely isolate. The Tri-Center will continue to operate into the new year, and residents looking for a safe place to isolate can call 443-984-8915. I would also like to remind residents that with the holiday season upon us, it is very important that you continue to avoid celebrating with individuals outside of your immediate household. The current executive order limits Baltimore City gatherings to 10 people indoors and a maximum of 25 people outdoors. We have reached widespread community transmission here in the city, and it's safe to assume that people not in your immediate household could be carriers of COVID, even if they aren't showing symptoms. We know that COVID-19 thrives in settings where social distancing and mask-wearing guidance are not being followed, and family gatherings remain a high-risk setting for COVID-19 transmission. Not feeling sick is not a good enough reason to endanger your family, as we also know that up to 50% of COVID-19 cases do not show symptoms, yet they're able to transmit. With our hospitals currently near 90% capacity, and with record high case numbers in recent weeks, and numbers still being reported above 250 new cases per day here, now is not the time to relax our efforts. Please continue to avoid social gatherings, wear your mask over your nose and mouth, wash your hands, and practice social distancing whenever you're out. Thank you.
Thank you, Dr. Rosa. We know that COVID-19 continues to have an outsized impact on our black and brown communities here in Baltimore. I want to take a minute to speak particularly about the impact on Baltimore's Latinx community. While our Hispanic residents make up just over 5% of the population, they currently represent 15% of our COVID cases here in Baltimore. Baltimore City's disproportionate rates of COVID-19 in the Latinx community reflect a national trend. The high rate of COVID-19 in the Latinx community could be attributed to many factors, including exposure to the virus as essential workers, crowded or multifamily living situations, limited access to health care, and exclusion from federal relief programs. Today, on International Migrants Day, I want to publicly state my support for the immigrant community in Baltimore and reiterate my administration's determination to ensure that our Latinx and immigrant neighbors get the resources and support they need to stay safe during COVID-19 and beyond. In Baltimore, we know that we cannot protect public health and well-being without ensuring that all residents, regardless of their identity or status, have access to care and support. Furthermore, we know that the effectiveness of our local response and recovery efforts depend on our ability to coordinate strategically across public agencies, community-based organizations, faith-based institutions, and other entities working with or on behalf of immigrants, and in this case, Latino immigrants. I want to bring up now Catalina Rodriguez Lima, Director of the Mayor's Office of Immigrant Affairs, to walk everyone through this new strategy to keep our Latinx members of our community safe. Catalina?
Thank you, Mayor, and I want to thank you for your support and leadership, and thank you, Dr. Rosa, for all of your support over the last 9 months. Over the last 9 months, MIMA has refocused its efforts to prioritize and respond to the immediate needs of immigrants impacted by COVID. Our work would not have been possible without the partnership and support of city agencies, philanthropy, immigrant-serving organizations, faith-based groups, and community stakeholders ready and willing to assist our most vulnerable families. The Prevention, Control, and Support Initiative will allow us to increase our capacity to better serve Latinos disproportionately impacted by the pandemic over the next year. The initiative is a result of months of collaboration between government agencies, nonprofit organizations, religious leaders, and community stakeholders working with MIMA and the Health Department to increase coordination of the resources when responding to the needs of Latinos impacted by the pandemic. The work group has included regular meetings of representatives of the following organizations: CASA, Catholic Charities Esperanza Center, Johns Hopkins Centro Sol, Southeast Community Development Corporation, Johns Hopkins Hospital, Friends of Patterson Park, Breath of God Lutheran Church, Sacred Heart of Jesus, Iglesia de la Resurrección, Healthcare Access Maryland, the Tri-Center, Baltimore Core, and the Maryland Health Department. The partnership builds on existing efforts by the Health Department and MEMA around community testing, bilingual contact tracing, isolation support, bilingual and bicultural messaging, and support for families with limited access to federal benefits. The work group's overall goal is to reduce the impact of COVID-19 in the Latino community living in the city of Baltimore by implementing a coordinated and multi-pronged strategy that is culturally and linguistically appropriate. The COVID-19 Prevención, Control y Respaldo strategy will incorporate the following additional components. The city will partner with CASA to enhance bilingual and bicultural public messaging and in-person outreach to continue to educate limited English proficient Latinos about limiting the spread of the virus, where to get tested, and where to isolate, while demystifying myths that prevent this community from seeking help. Furthermore, community messengers will educate residents about the importance of getting vaccinated once a vaccine is available. CASA will recruit trusted community members who live in the community to serve as community messengers, promotores, or promotoras. Their role will be to educate the neighborhoods hardest hit by COVID to prevent the spread while guiding community members to trusted sources of information and resources. Another component of today's initiative will be to support individuals testing positive for COVID. Under this phase, the City of Baltimore will partner with Catholic Charities Esperanza Center to staff a set of resource navigators to help residents excluded from public benefits and with a positive test locate services and resources to help them through the isolation period and beyond. These resource navigators will be trained in navigating different government systems and will be knowledgeable about eligibility criteria based on immigrant status. Finally, resource navigators will connect residents to financial support from MEMA's Emergency Relief for Immigrant Families Fund to encourage isolation while minimizing financial pressure to continue working despite health risks. The COVID-19 Prevention, Control, and Support Initiative is funded through a public-private partnership by the City of Baltimore, the Able Foundation, CareFair's Blue Cross Blue Shield, Gold Secker Foundation, the Stallman Charitable Foundation, and the Strauss Foundation. I also want to thank the number of funders, too many to mention, that have supported our efforts to assist families excluded from federal benefits through the Emergency Relief for Immigrant Families. This initiative has raised over $2 million and supported approximately 2,300 residents. Finally, I'm grateful for the leadership of Mayor Scott and Dr. Rosa. They have taken important measures to protect the health and safety of our residents impacted by the pandemic.
Thank you, Catalina. This work, as Catalina pointed out, would not be possible without strong, trusted partners on the ground like CASA and the Esperanza Center. I'd like to now turn it over to Lydia Walter Rodriguez from CASA Baltimore and Central Maryland Region Director, the Central Maryland Region Director, to talk further about this initiative.
Thank you so much, Mayor, and good afternoon, everyone. My name is Lydia Walter Rodriguez, and I am the Region Director of CASA here in Baltimore. CASA is the largest immigrant, Latino, and working class families organization in the Mid-Atlantic, advocating, fighting, and providing direct services for Latino immigrants and working class families. We know that our Black and Brown communities have been under attack long before this pandemic, suffering a pandemic of systemic oppression and racism before COVID-19 struck. We know after COVID-19 struck, the federal administration continued their attacks to our immigrant community, despite the humanitarian crisis that was undergoing. In consequence, our community, our immigrant and Latinx community, continued to distance themselves from any government entity, including local entities, out of fear of the continued attacks that they are hearing from the federal administration. This has created and continues to create a service gap for our community members to trust applying for these humanitarian reliefs. And we knew this very early into this pandemic, starting in March. We knew that we had to respond and act quickly, having over 100,000 members CASA-wide footprint, but also over 12,000 here in Baltimore City. We knew that we could not allow for community members to let fear keep them from applying for these relief efforts. Very quickly, on the 8th of April, we started a zero-contact food delivery operation out of our new center in Baltimore City, allowing us to serve over 600 community members in zero-contact food operation. And later, we opened in July a drive-up food operation, which has allowed us to serve weekly over 2,000 Baltimore City community members in food security. But we know that food security cannot be the only thing that we are doing. So we have been partnering this food security with wraparound services, wellness calls, making sure that community members know what test sites that they can go and trust to be able to do the COVID-19 test, as well as provide much needed information in relief efforts and ensure that our immigrant community is included in those relief efforts. Many in our community have distrust potential services like eviction prevention, and have come to us with so many cases of employer fraud during this pandemic. And we have supported them with many legal consultations, as well as provided support in applying for these much needed services. We are very grateful for the leadership in Lima and the leadership in the mayor in continuing to do the extraordinary work that they do and continuing to trust our organizations that have built that trust of decades with the community and act as a bridge to ensure that all in Baltimore City are receiving these important services that are going to happen long after the COVID-19 pandemic ends.
Thank you, Lydia. We are also joined this afternoon by Matthew Dollamore, Director of the Catholic Charities Esperanza Center. Matthew?
Thank you, Mr. Mayor. My name is Matthew Dollamore. I'm Director of the Esperanza Center. We are a program of Catholic Charities of Baltimore, and we're located here in Baltimore City, providing comprehensive immigration services to the community. In the past year, 2,600 immigrants came to our health clinic to receive primary care free of charge. 1,700 received life-saving legal services. Over 500 improved their English communication skills. We opened a hotline to serve the COVID-19 impacted community of Spanish-speaking individuals in March. Since that time, we've had over 3,000 calls, nearly 50% of which have been referred to testing. Our mission at Esperanza Center is to welcome immigrants by offering hope, compassionate services, and the power to improve their lives. This initiative today offers hope. Hope that no family in Baltimore should ever be forced to choose between their health and their income. Compassion. Our team of bilingual professionals will provide committed and uplifting services to improve and enhance each family's well-being and preserve their dignity. This initiative will be empowering. Our case managers will support families in achieving their goals and accessing the resources they need to overcome illness, loss of income, food insecurity, or other issues. In this, we are very grateful to the Mayor's Office, to MEMA, to the Department of Health for their vision and leadership. We are very grateful to Casa de Maryland and our other community partners in this initiative. And most of all, we remain grateful in everything we do to the community who puts their trust in us to provide service. Thank you.
Thank you, Matthew. Next, we will have Reverend Rosa Margarita Santana. Reverend?
Muy buenas tardes, Mayor y asistentes. Quisiera hablar en español, si es posible, y le he pedido a...
Good afternoon. If I may, I'm going to speak in Spanish.
Desde los últimos 10 meses Nuestra ciudad ha estado dolida, hemos tenido pérdidas.
During the last 10 months, our city has been hurting. We've lost people.
Y la comunidad latina ha sido prioritariamente una de ellas.
And the Latino community has been highly impacted.
Pero gracias a la ayuda que hemos recibido de la ciudad, en nombre de la comunidad latina, queremos darle las gracias por los recursos que han dispuesto para nosotros desde los últimos meses.
We want to thank the city of Baltimore for all of the help and resources provided over the last few months to help the Latino community.
La comunidad latina, como trabajadores independientes, han perdido trabajo, pero esta ayuda les ha proporcionado respiración en gran parte, con la renta y con proveerles alimentos a ellas.
As many independent workers, Latinos have been highly impacted by the pandemic, and the resources provided have been helping them pay rent and other needs that they have.
Y ahora con esta nueva disponibilidad de recursos, creo que vamos a estar agradecidos más con la ciudad.
And with the new resource being developed by the city, we're even more grateful to our leaders and to our city.
Así es que a nombre de la comunidad religiosa queremos darle las gracias y esperamos que continuemos trabajando mano a mano para poder ayudar más cada día a las familias.
In the name of the religious community, I want to thank you for your support, and we want to continue working with you to benefit the community.
Thank you.
Thank you. Thank you, Reverend Santana. We are now going to hear from Cynthia Sanchez, a community member. Cynthia?
Hola, buenas tardes. Mi nombre es Cynthia Sánchez. Desde hace 11 años vivo en la ciudad de Baltimore. Por favor, necesito.
Good afternoon, my name is Cynthia Sanchez, and for the past 11 years, I have been living here in Baltimore City.
Con la pandemia del coronavirus ha sido muy difícil para mí y para mi familia. Primero porque perdimos nuestros trabajos. Mi esposo sufre de una enfermedad crónica, de epilepsia, y debido a la falta de trabajo y dinero, su salud empeoró.
This pandemic has struck our family very hard. To start, we all lost our jobs. And it breaks my heart because my husband suffers from epilepsy, and this virus has taken everything from us.
Todos en mi familia nos enfermamos del coronavirus, pero mi esposo, por lo que él padece de epilepsia, tardó mucho en recuperarse.
Everyone in my family early on tested positive for COVID, and my husband, because of epilepsy, suffered the worst.
Este año ha sido tan terrible para nosotros en todos los aspectos. Sin embargo, gracias a la ayuda que he recibido de casa, me he sentido apoyada y sé que cuento con el respaldo de ellos.
This past year has been a difficult time for myself and my family, and I'm happy that I can trust organizations like CASA, who I can rely on during these hard times.
Yo conocí de casa porque en una ocasión miré que se estaban organizando para repartir alimentos afuera de sus oficinas. En ese momento yo necesitaba alimentos y ellos, sin pedirme nada a cambio, llevaron alimentos a mi casa semanalmente por 4 meses.
I heard about CASA through the Food Operation Distribution Program as they were outside of the office. CASA supported me in bringing me weekly groceries for over 4 months without asking anything in return.
También recibí tarjetas con dinero del programa del Fondo de Solidaridad, dinero que ocupé para comprar los medicamentos que mi esposo necesita porque él toma 11 pastillas diarias.
I was also provided cash assistance to support myself and my family during this time. I used that cash assistance to buy the medication for my husband. Because of his epilepsy, he takes 11 medications per day.
También Casa me ayudó a aplicar al programa de apoyo con el pago de la renta que está ofreciendo la ciudad de Baltimore. Ellos me ayudaron a llenar la aplicación, a recabar y subir documentos, porque no tengo los conocimientos acerca de las computadoras y hay términos y preguntas que son muy difíciles de entender para mí.
I was also assisted to ensure that I was not evicted through the eviction prevention program by CASA. There are so many things that are hard for me to comprehend. And on top of that, computer literacy to upload certain documents. I'm grateful that I was able to be given the assistance to be able to apply and successfully be admitted into the program.
En casa las personas son muy capacitadas y entrenadas para ayudarnos en todo. Gracias a esto, me pude beneficiarme del programa y aprovecho para agradecer al alcalde por mantener estos programas que están beneficiando a miles de familias necesitadas a causa por la pandemia.
I benefited from this program, and I want to take this time to personally thank Mayor Scott for all of his leadership and all of the benefits that many in community have also received through this program.
Muchas familias fuimos excluidas del cheque que envió el gobierno federal, pero cuando la ciudad abrió este programa, fue una gran bendición, un gran alivio para todos nosotros.
Many of us were disheartened when we did not get the stimulus check because of our immigrant status, and we are grateful that the city opened up this program and we have benefited from it.
Además, Casa me ha enseñado sobre los derechos y cómo puedo como inmigrante apoyar a las diferentes necesidades que tenemos todos los que vivimos en la ciudad.
I have also learned about my rights, and knowing your rights is important for all of us to know in the city.
Yo antes pensaba que no podía participar, que solo personas elegidas lo podían hacer, pero ahora hasta más miembros de mi familia se han sumado a la lucha.
I did not know that I could apply, and only certain people could apply and receive, but now I have motivated many in my family to also apply.
Yo quiero agradecer a Casa por todo lo que están haciendo, pero también a Lima, porque gracias a estas alianzas que estamos construyendo, vamos a responder a más personas de nuestra comunidad. Muchas gracias por su atención. Soy el reflejo de muchas familias necesitadas y gracias a Dios por estas organizaciones y por nuestras autoridades. Dios les bendiga.
I want to thank CASA, and I also want to thank MIMA and all of the organizations that have come together in coalition, because together we will be able to reach so much more that are in need. And I want to say thank you for your time.
Gracias.
Thank you, Cynthia, for sharing your experience and all that your family has been through throughout this pandemic. I want to thank the Health Department and the Mayor's Office of Immigrant Affairs for convening critical partners to develop the COVID-19 prevention, control, and support initiative to mitigate the impact of the pandemic on our Latinx community. I believe that this strategy represents a more coordinated effort around communications, testing, healthcare, and economic resources for those in the Latinx community impacted by COVID-19. I also want to thank the members of the Latinx work group for their time, guidance, and commitment to our most vulnerable residents here in Baltimore. As we battle this public health crisis, equity will continue to be my guiding principle. I'll be focused on ensuring economic and health resources are inclusive of immigrant communities regardless of language, immigrant status, or the ability to access technology. I want to today Also, talk about another important initiative to ensure that our neighbors do not go hungry as certain federal dollars expire as we head into the new year. I understand that the pandemic has caused unprecedented hardships for families and residents. COVID-19 has deepened the inequity of food security in Baltimore, especially in our Latinx and Black communities here in Baltimore City. My administration is committed to funding and implementing the city's 4-point COVID-19 emergency food strategy. As a result, I made the decision to commit over $5 million to provide 20,000 food boxes per week to nearly 100 sites plus home delivery through March. That will result in almost 6 million pounds of food moving through Baltimore City in the next 3 months. There will be no gap in the extensive food box program that offers produce boxes, mixed food boxes, and home delivered grocery boxes to our residents. These boxes provide the perishable products that are always lacking in many of our neighborhoods and have been made even more difficult to obtain because of COVID-19. The food box program has been rooted in strengthening community organizations' abilities to provide food for their neighbors. Our wide network of outdoors distribution sites in neighborhoods across the city ensures that no one has to travel far to get food, which in turn helps to mitigate the spread of COVID-19. Baltimore's grocery home delivery program specifically serve households that have been impacted by the virus. I want to thank the tireless staff and volunteers at our community organizations, schools, and rec centers for their tremendous effort to feed our city. I would also like to thank all of our food service partners, including the Maryland Food Bank, Coastal Sunbelt, the Common Market, Savile Food Service, and Amazon Flex. Boxes will be available at nearly 100 sites plus the home delivery, as I said before. And please, if you need more information about the food, please go to coronavirus.baltimore.city and click food resource to find these resources. Again, that's coronavirus.baltimore.city and click food resources to find these resources. And now I'll take a few questions. Ma'am? Click it on. Nope, just yell. As you know, we were just made aware about the legal action. The law department and city solicitor are reviewing it. Again, I want to say this, and I'm going to continue to say it until folks hear it. What we did was guided by public health, science, and advice, period. And this is the only question we're going to answer about this topic. That is all. We will not understand that we are not operating on a whim. This is stuff that has been advised to us by public health experts, Dr. Rosa, the folks at Johns Hopkins, as you saw them here last week. We will go through the process, the legal process, and we'll have more information as our legal team reviews the information. We will still stick to our plan to look at our restrictions after the period, the 4-week period that we set forth last week.
So no plan to amend it currently?
We will stick to the 4-week period that we laid out last week. Jane?
To Ms. Rodriguez-Lima, may I ask you a question?
Yeah, sure.
As vaccine distribution begins on that, phase A1, phase A1B, etc., considering the mistrust of government and other institutions in the Latino community, what do you anticipate is going to be the challenge of vaccinating members of the community?
Yeah, thank you. Part of our strategy is the prevention component, which seeks to increase communication and outreach to talk to the community and speak to the community about the importance of getting vaccinated. Those promotores that I mentioned will be members of the community. We understand that as government, our message may come in differently than if it's coming from the community. So those promotores will be there to talk to the community because they have been in the community and they're trusted voices that they listen to.
Has there been concern expressed over the past few weeks as first the Pfizer vaccine, now the Moderna vaccine is about to come on board, where obviously a vaccination plan is now being spoken about daily?
Absolutely, and we're already discussing messaging, but also how to disseminate that message, going beyond social media outlets and ethnic media, but really doing outreach, in-person outreach, whether it's canvassing, door knocking, speaking to people in the parks and the grocery stores. We'll do everything it takes to get to the community wherever they are.
And Jane, just to add to that, Jane, I think it's important, and this is something that Dr. Duraza and I have spoken about, and we're going to have a whole effort around that. We know that there is a mistrust of vaccines here in Baltimore, specifically in our black and brown communities, and our black community in Baltimore because of the history. We know that we're going to have credible messengers that are going into communities, working with community partners, people on the ground. You're going to have black doctors and scientists, Latinx doctors and scientists, everyone that can help break down that mistrust that, let's be very clear, is in well regard because of things that have happened in the past. But we also have to inform people of the science that we have today, and we will do that.
In regards to the new contact tracers, can you tell us how many you plan to bring on board for the Latinx community, and how many currently speak Spanish or are bilingual?
Yep, I will let Dr. Zaraza and Catalina answer that question.
In the second half, just how much of city funds might be going towards this new program?
So, as a part of our Baltimore Health Core effort, so the effort that was launched over the summer, which include hiring of contact tracers as well as community health workers, we've been very intentional about trying to recruit bilingual contact tracers. I think we currently have 6, but we can get back to you on more specific numbers.
But there will be an increase from that 6,
Yes.
correct?
Yep.
Okay.
In terms of the outreach resource navigators and cash assistant, that is an investment of $1.3 million. Approximately 80% of those funds are coming from the city.
And just for Catalina, how many contact tracers do you think the city needs to serve the Latinx community properly?
I'm gonna let Dr. Duraza answer that.
So, I mean, I think certainly it's partly the number, but partly quality, right? So we want to make sure that we're recruiting and hiring the right people that are trusted within the community. So I don't know that there's a specific number per se, as much as we want to have people who are trusted by the community, who will pick up the phone when they're called, and who'll provide the accurate information and will receive services that we offer.
Thank you, everybody.